Liver disease is a hugely important problem in Europe. It kills people at a young age. More than 80% of deaths are in working age. It kills more than 2.3 million. It causes more than 2.3 million years of life lost up to the ages of 50. And to put that in context, that is more than lung cancer, breast cancer, ovarian cancer, and prostate cancer combined. My liver patients drink huge quantities of alcohol. The average consumption of my patients with cirrhosis is the equivalent of 4 or 5 bottles of wine a week. Because they're drinking so much, they're buying the cheapest alcohol it's possible to find. And in the research that I'll be presenting this afternoon, I'm going to show that on average they spend about 30 pence per unit of alcohol, that's a centilitre of alcohol, compared to more than £1, about £1.30 for an average low-risk drinker. If you put those two factors together, then if you set a threshold below which you can't charge for a price for alcohol, if you set, say, a threshold at 50 pence, okay, it's not going to affect the vast majority of people. It's not going to affect low-risk drinkers at all, but the impact on my really heavy drinkers is going to be huge. If you look at the data on the impact of educational interventions, it has no impact on behaviour. So if you want a policy that is going to reduce alcohol-related deaths, reduce liver deaths, and we desperately need such a policy, then we have to look at the evidence of what works. And we know that the most effective and the most cost-effective policy is to increase the price of alcohol. What's unique about minimum unit price is it's a way of increasing the price of alcohol without affecting the vast majority of populations. The only people who are affected are the people who are drinking too much. In terms of OECD nations, the economic cost of alcohol is about 2 or 3% of GDP. If you take into account third-party harm, in other words, the relatives of people with alcohol-related problems, the children killed in alcohol-related traffic accidents, then that figure doubles to 4 to 5% of GDP. If you look at that in the UK, in terms of the cost to a taxpayer, the average cost to a UK taxpayer is £38 a week. That's what they're paying for alcohol at the moment. They're effectively subsidising the drinks industry. With the right policies, then within 20 years we could be back where we were in the 1980s with a liver mortality of 4 per 100,000, which is as good as anywhere in Europe. And furthermore, the other countries in Europe with the same high levels of liver mortality and alcohol-related mortality could do exactly the same thing.